It's very crucial to know what their vagina smells like. Vaginal microbiome screening is a very powerful tool to enable the patient to understand exactly which pathogen is causing their symptoms.
The gut and the vagina. So even though they are two discrete systems, it seems they are still connected.
If you have a healthy gut microbiota, this is how they get transferred to the vaginal microbiota and contribute to you having a healthy vaginal microbiome as well.
Are there any ways that we can safely take care of the vaginal microbiome in the instances of hair removal?
Very interesting study came out which demonstrated that women who remove their pubic hair tend to have a lower diversity of good bacteria.
We've got a multi-billion-dollar industry promoting the idea of vaginal freshness, and that's likely leading to this wave of vaginal dysbiosis. Today's guest is Valentina Milanova, founder and CEO of Daye, which is all about vaginal health, hormonal health, and period care. Together, we discuss the science of the vaginal microbiome and how you can look after your private parts even better. Now, if you want to learn even more about the vaginal microbiome and chronic women's health conditions, you can pre-order my book, This is Vital Information, and all the links are in the description below. Before we get started, if you're enjoying what you're hearing, please consider subscribing to the podcast. It really helps to reach even more people. Thank you very much. Now on to Valentina. Valentina, it's not often I get the chance to say this, but I love to talk about the vaginal microbiome. I know it's a bit early in the morning, but I think there's never a time of day where we can't discuss such things. It's interesting because the vaginal microbiome is a very specialized, low diversity ecosystem. In contrast to the gut microbiome, where generally microbial diversity is encouraged, and we think that's a good thing, but it's something dissimilar in the vaginal microbiome, where it's dominated by lactobacilli bacteria, and that's for a reason. Do you want to take me through a little bit about the ecology and, uniqueness of the vaginal microbiome?
Yeah, I love that you started with the differences between the vaginal microbiome, the gut microbiome, and the skin microbiome. That's exactly the one key difference. There's a significantly reduced diversity of the bacteria which can survive in the vaginal microbiota. So from a clinical perspective, what this means is that there's significantly larger percentage of clinically relevant pathogens in the vaginal microbiota for which we have an established treatment pathway. So doing vaginal microbiome screening or vaginal microbiome sequencing can be a very powerful tool to really understand the workings of this effectively immune system to the reproductive tract. This is what the vaginal microbiome is. We often hear it being said anecdotally that the vagina is self-cleaning, and this is why you shouldn't douche, you shouldn't really soap the inside of your vaginal canal, because it has already a built-in mechanism which keeps it at the right level of acidity so as to prevent the overgrowth of opportunistic bacteria, which we know cause bacterial vaginosis, yeast infections, recurrent vaginal symptoms. And I personally feel incredibly passionate about spreading more awareness about the role that the vaginal microbiota plays in our overall reproductive health. I don't think we know enough about it in day-to-day conversation. Science certainly has made meaningful breakthroughs, and I was so encouraged to see the MHRA this year published a guideline on how to do vaginal microbiome screening responsibly, how to offer patients treatment on the basis of their vaginal microbiome results. And the UK is really starting to lead globally the conversation on vaginal microbiome health.
So if we look at the chemistry and biology of the vaginal microbiome, we said it's dominated by various lactobacilli strains, which each perform different functions. Lactobacilli produce lactic acid and lower the pH of the vagina, which is beneficial for defense against unwanted pathogens and infections. These lactobacilli also produce antimicrobial compounds against other unwanted pathogens as well. And so we know that it's this low pH lactobacilli environment and things which can actually raise the pH and make it more alkaline is going to disrupt that environment. So you mentioned some of the things there, douching, but even things like sexual intercourse can transiently raise the pH of the vagina. You mentioned we don't really know much about the vaginal microbiome. What do we know right now and about what specific bugs could be beneficial?
Well, one thing that's very important to know, because you mentioned sexual intercourse, semen is one of the biggest disruptors to vaginal microbiome health. So if you are not someone who is actively trying to conceive, even if you are on long-term contraception, say the IUD, the patch, the ring, you should still use protective barrier methods of contraception in order to preserve the health of your vaginal microbiome. So far, what we know is that a disrupted vaginal microbiome leaves you more prone to a cycle of recurrent vaginal infections, recurrent UTIs, and in the fertility context, having a disrupted vaginal microbiota means you are exposed to a higher risk of preterm labor and miscarriage. And this final part about the vaginal microbiome is one that I feel particularly passionate about. Vaginal microbiome screening used to be a prohibitively expensive procedure. One of the benefits that we have as societies post-COVID is that quantitative PCR technologies, which we use to screen for COVID, have now become significantly more cost-effective, which means that the majority of UK labs and labs around the world have a PCR machine sitting on their shelves gathering dust, which can now be used to offer affordable vaginal microbiome screening, so that a patient identifies the presence of a specific pathogen, say ureaplasma, mycoplasma, Gardnerella, which in the literature and in real-world clinical outcomes have been associated with an increased risk of miscarriage and an increased risk of what we call persistent unexplained infertility. So I feel very passionately about women being offered the tools to identify exactly which pathogen is causing disruption, so that we can then target that pathogen. And in the context of antimicrobial resistance, this is so important. What we see a day on a daily basis, I genuinely didn't think this was scientifically possible to see patients with 0 lactobacilli, completely wiped vaginal microbiotas. And these are often patients who have had recurrent vaginal symptoms, say for 5 years, for 10 years. And the current standard of care is, in bacterial vaginosis, the whiff test, which, does what it says. We diagnose bacterial vaginosis, we diagnose vaginal symptoms, not with the level of precision that we can and that we should. So what ends up happening then is we prescribe the wrong type of treatment. So say someone has ureaplasma or mycoplasma, their symptoms appear to be those of bacterial vaginosis or of a yeast infection. They're offered yet another round of antifungals or yet another round of antibiotics, which do not target the pathogen which is actually responsible for their symptoms, but these treatments do wipe the good bacteria, because antibiotics, antifungals, they work indiscriminately. They can differentiate between lactobacilli and pathogenic microorganisms. So I feel very passionately about using vaginal microbiome screening as a tool to enable the patient to understand exactly which pathogen is causing their symptoms, so that we can then personalize the treatment that they're receiving and prevent the cycle of infection treatment, which often wipes all of the lactobacilli indiscriminately, which then leads to a reinfection, another treatment, another reinfection, etc.
So, given that a abnormal and dysbiotic vaginal microbiome could put a woman at an increased risk of bacterial vaginosis and other gynecological issues down below, various discharge, UTIs, infections, pelvic inflammatory disease as well. I wonder how many women have these UTI symptoms and vaginal symptoms that are not true urinary tract infections and could be something microbiome related, and then are given unnecessary antibiotics to treat something which isn't a pathogenic bacteria, but rather an imbalance in the lactobacilli, and then that would presumably compound the problem. And this brings me to the link between the gut and the vagina. So even though they are two discrete systems, it seems they are still connected because, connected via the perineum. So presumably, you've got this gut microbiome, which is stable. Whatever is excreted via the feces, there is some contact with the perineum, that skin bridging the vagina and the anus, and there is some translocation of bacteria from the gut to the vagina, in addition to the systemic effects of, what microbiome metabolites are produced. That also goes via the bloodstream, but there is that obvious skin connection there. And so even despite what you do externally or topically to the vagina, it is still influenced by your diet, what medications you take, your environment, because that changes your gut, which then introduces and influences bacteria in the vagina.
And this is not something to be afraid about. I know it can sound a bit scary that my gut is affecting my vagina. My anus is very close to my vaginal entrance. But if you have a healthy gut microbiota, which is full of rich, good lactobacilli bacteria, this is how they get transferred to the vaginal microbiota and contribute to you having a healthy vaginal microbiome as well. So very interesting study came out of Brigham's Women's Hospital in the US, which demonstrated that women who remove their pubic hair tend to have a lower diversity of good bacteria in their vaginal microbiota, because our intimate hair is one of the mechanisms by which good bacteria travels from our gut and our anus to the vaginal entrance. Separately from this, yes, we do know that maintaining a diet which is rich in prebiotic and probiotic foods is beneficial for the vaginal microbiome as well as the gut microbiome. We've seen this in observational studies. There is clearly a link between the gut and the vagina, just as there is a link between the gut and the brain. And this is definitely worth exploring and worth sharing as information with patients who have been struggling with recurrent UTIs, recurrent vaginal infections, recurrent vaginal symptoms that they can't find a solution to just by using antibiotics and antifungals. And we see this in our patient population all the time. Patients who have been told for decades that their vaginal symptoms are made up, that they're not real. We recently actually had a patient case where one of our patients was prescribed antidepressants because for 10 years she had recurrent vaginal symptoms. Her doctor was giving her tests for bacterial vaginosis and a yeast infection. She tested negative for both continuously, yet her vaginal symptoms had become so bad that she couldn't engage in vaginal intercourse. She couldn't wear leggings because they were contributing to her symptoms. She couldn't exercise. And it turns out that the real cause of her vaginal symptoms was not made up. It was ureaplasma, which at the moment, the British Association of Sexual Health, BASH, actually does not recommend diagnosing or treating ureaplasma in female patients, only in male patients. So even though she found that she had ureaplasma, the only way in which she could get treatment was by calling her Hungarian partner's family physician and getting a prescription out of him. So we also need an evolution of our clinical guidelines. And that's why I'm so excited by the work that the MHRA is doing at the moment. It's rare that a regulator is so at the forefront of scientific discoveries and is so quick to move on updating clinical guidelines. It's particularly rare to see that in women's health.
This is something I am ridiculously excited about, and I've been using it for a while now myself. We've all got wearables for our sleep, steps, heart rate, but the one thing we don't track, the thing that actually tells you more about your health than almost anything else, is your bathroom data. And that's why I joined the team at Throne Science. Throne is the world's first hands-free smart toilet platform that turns your everyday bathroom habits into real actionable health insights. It uses computer vision and sensors to analyze stool shape, color, consistency, frequency, even patterns like straining and time spent sitting on the toilet. And I've been helping to build out the science as well. No forbidden photos on your phone, no awkward Excel spreadsheets. You just do what you normally do, and Throne gives you trends that actually matter for your gut health, hydration, fiber intake, and even early warning signs you'd normally miss. If you want to be one of the early people to try this or just follow the journey, head to thronescience.com. That's thronescience.com. Trust me, it will be your gut's new best friend. You mentioned before that hair removal can upset the vaginal microbiome. Presumably this is because of microabrasions, which can then, be orifices for pathogens from the skin to then translocate and enter the vagina potentially. Are there any ways that we can safely, take care of the vaginal microbiome in the instances of hair removal?
So the hypothesis for how hair removal disrupts the vaginal microbiome is not so much through the microscopic skin abrasions that it can cause, but because it disrupts the pathway of good bacteria traveling from the gut to the vaginal entrance. So the hair serves as a bridge
Mm.
that transports the good bacteria from one area to the other. So trimming your pubic hair, if that's something that you want to do, trimming it versus entirely removing it is a good way to ensure that that pathway for transportation of good bacteria still exists. Now, the other thing to keep in mind is that if you have a very disrupted gut microbiome, for example, if you have E. coli as a pathogen present in your gut microbiome, by virtue of that same bridge, it can travel to your urethra, it can travel to your vaginal entrance, which is how some patients develop recurrent UTIs. So again, looking after your vaginal microbiome is not something you can do in isolation of your gut microbiota.
So it probably makes sense also to not use one shaver for multiple body parts. So, if someone is using a shaver for their face, their groins, their armpit area, other parts of
Yeah,
the body, but then also using it in the vaginal area, that
yeah,
seems like there
absolutely.
may be lots of, for want of a better phrase, cross contamination.
Yeah,
And, the
absolutely.
native bacterial species which live in the groin or the vagina or in the face, could be harmful if then explanted and then transplanted in a new area where it doesn't belong.
Yeah, absolutely. You need to at least sanitize the shaver that you're using or the trimming tool that you're using before you move between areas, but preferably you have a different dedicated grooming tool for the different areas.
The vagina obviously is important for gynecological health, and the bacteria are involved in defending proactively that vaginal ecosystem. But also, if a woman were to have a child, the vaginal canal is obviously the first point in a
Hmm.
baby's life where they will be seeded with bacteria, and that forms
Hmm.
the early embers of a baby's microbiome, the infant microbiome through the vaginal canal, in vaginal births, that is. So, longer term, if a woman is pregnant, the health of the vagina can determine the health of the baby's microbiome and then the health of the child for the rest of their life. It can really set them up. So, what are your thoughts on vaginal seeding? It doesn't seem to be a lot of evidence behind this, where people take swabs of the vagina
Hmm.
and claim that this can somehow help to improve the microbiome of a child that is born via C-section. What do you think about that?
Have you read the study, which also came out of Harvard? Professor Raina Fichorova
Mm.
led that study over 20 years, where she took samples of the mother's vaginal microbiome during pregnancy, just before labor, after, and then they looked at the cognitive development of these children that were born, and the children of mothers with a richer vaginal microbiome, with a bigger diversity of lactobacilli and a lower percentage of pathogenic microorganisms, these children end up having better cognitive outcomes than the children of mothers who had a vaginal microbiota which was fuller of pathogenic microorganisms and
Mm.
less rich in lactobacilli. So I often think back to the study because as humans, we're so quick to be self-congratulatory when it comes to our successes and achievements in life, whether it's like education or professions. And what if it all goes back to the health of your mother's vaginal microbiome, which you had no way of knowing and very little ways of influencing at the time of your birth? So yes, that's why vaginal birth deliveries are also so important, because the baby is passing through the vaginal canal, and during this passing process, its nose and its mouth are really filled with the vaginal secretions, which contain the vaginal microbiota. So in terms of the practice that we have now, which is actually quite well adopted within Europe and the United States, of taking a swab from the vaginal microbiota and then transferring that to the baby's nose in the baby's mouth, I think it's better than nothing. It's better than not introducing any bacteria to the newborn, but it cannot replicate the experience of sometimes hours in the vaginal canal, and the introduction of bacteria that comes through birthing through the vaginal canal, which of course shouldn't make anyone who has to go through a cesarean feel guilty. There are other ways of introducing good bacteria to your child's microbiome. Breastfeeding is an excellent way of doing it. And then as the child develops, feeding them a rich diet of whole foods and prebiotic and probiotic foods, exposing them to dirt. Gardening is actually one of our really powerful tools for enriching our human microbiota.
In addition to that longer term health of the child and, forming that sort of that seeding of the child's microbiome, it also has a role at the other end of the spectrum in that preconception phase in affecting and influencing fertility as well. The vaginal microbiome can directly affect fertility, not merely through the presence of fertility blocking microbes, things like chlamydia, gonorrhea, a bunch of other pathogenic microbes which can cause, blockages of the fallopian tubes, but, even cause aberrations in the pH, thinning the mucus layer. There's a clear role and pathophysiology by which STDs, STIs, a dysbiotic vaginal microbiome can decrease someone's fertility as well. And that could be a very non-obvious cause.
Yeah, I mean, Professor Philip Hay from Imperial College London has demonstrated this in clinical practice, that patients who have bacterial vaginosis are a lot more likely to experience preterm labor. And this is important for us to know, because bacterial vaginosis is not an unknown experimental condition. It's a condition for which we have established treatment pathways, and it's a condition that we can influence during pregnancy as well as before pregnancy. And given that the cost of vaginal microbiome screening has gone down so much post-COVID, I think we have no excuse for not offering this technology to patients, especially now that we're starting families later in life, which means that we're naturally going to go through more fertility difficulties. We're naturally going to experience more instances of miscarriage. Having this tool that enables us to identify a simple blocker to fertility, right? Because influencing the vaginal microbiome is much easier than influencing the gut microbiome. Again, there are established treatment protocols, there are established clinical pathways which have been proven to be effective. Doing so before you start a conception cycle, and particularly before you start IVF, before you start a very expensive conception cycle, is so important.
We've seen a huge rise in, a new pedestal or a new sort of pinnacle to reach in terms of body image. Thanks to social media and sort of online blogs, there's constantly evolving expectations of what, a body should look like, or ideal body should look like. But also, we've seen that trend not just in bodies, but actually, in private parts as well. So the vagina probably has the most amount of, again, not very obvious body shaming associated with it. There's certain societal expectations about what a vagina should look like and what it should smell like. And that has been compounded and emphasized by this whole slew of advertising directed at vaginal hygiene, the body odors, scents, perfumes, douching. And on the one hand, we hear a lot about how you shouldn't wash your vagina with soap, put in scented deodorants and fresheners and things in there. But the other side, we've got a multi-billion-dollar industry where people are literally promoting the idea of vaginal freshness. It just doesn't compute how they still have an incredible amount of sales, and that's likely leading to this wave, this pandemic of vaginal dysbiosis.
Yeah, this makes me so upset and so violently angry. This whole industry that is telling women there's a particular way in which your vagina should smell, and that way includes like flowers and butterflies. And only if you spend £8.99 with us, then we're going to give you that perfect vaginal scent. It doesn't exist. And most importantly, it's very crucial for a patient to know what their vagina smells like. So one of the interventions that anyone can implement in order to better look after their gynecological health is to smell your knickers. Smell your knickers every day, smell them while you're going to the loo, smell them at the end of the day so that you get used to what your usual imbalance vaginal scent is like. And that way you can detect early when a dysbiosis is happening so you can start taking action. And beyond this whole absolutely useless industry, which is teaching women that we need to have perfumed tampons and perfumed pads, and we need to mask all of our scents. So, first of all, it is highly unlikely that anyone other than your intimate partner has ever sensed what your vagina smells like. It is not an armpit. Usually it is, protected by your underpants and your trousers and your jeans. It is highly unlikely that anyone is sitting in a meeting room at work or sitting in the office or sitting on the tube and anyone else can sense what your vagina smells like. Secondly, if you are in a relationship where your partner is creating expectations for the way in which your vagina should smell like, this is a very big red flag and a reason to reconsider that relationship from a first principles perspective. And beyond everything that we're taught on social media about the way in which our vaginas should smell, the way in which our menstrual discharge should smell as well, we're also taught by the pornography industry that there's a particular look for the vulva. And for the labia. And labiaplasty is one of the most popular plastic surgeries in the UK because of pornography, because a lot of pornographic actors are people who have undergone labiaplasty. So we have this completely distorted image of what the labia and what the vulva should look like. And the answer to both what your vagina should smell like and what your labia should look like is there is no right answer. It is, just as our eyes and our noses and our ears are completely different, the same goes for the way your vagina smells and the way your labia looks. And with labiaplasty in particular, one thing that anyone considering a labiaplasty should think about very carefully is that the scar tissue, which can often form as a result of the labiaplasty, can affect your overall vaginal comfort. It can create painful sex, painful intercourse. So it's very, very important to consider the risks of this procedure for which there's no going back. We have not yet invented a reversal for the labiaplasty. Similarly, if you are someone who douches or uses scented menstrual products, vaginal deodorants, all sorts of ridiculous products, it is hard to revert the negative impact of these products. All you need is a gentle pH balanced soap, which you can use from time to time. You don't need to use every day, perhaps after a particularly sweaty workout. Entirely on the outside. Just, warm water is sufficient for you to clean your vulva, and you should never clean inside the vagina because the vagina is self-cleaning. And the most perverse thing is that these vaginal deodorants and douches and creams and whatnot, they disrupt the vaginal microbiome, which is then going to lead to a cycle where you're more likely to experience unusual, maybe perhaps stronger vaginal scents.
Similar to my experience that I've seen patients over the years who have been on antibiotics for a while, we know it can take months and even years for the gut microbiome to come back to baseline after a course of antibiotics. I assume it was something similar with the vagina as well. And beyond some of the microbiome disruptors that we've mentioned, douching, some of these washes, there's other things which somehow, is not fully a controllable risk factor, which is the variation in hormone levels. So we know estrogen, it's a very pro-lactobacilli encouraging hormone. So during that puberty phase, increased estrogen surges is beneficial for the vaginal microbiome. And then we see at the perimenopause, menopause, when there's a decline in estrogen, there can be further imbalances and potentially a loss of that existing lactobacilli diversity, which can then lead to problems, vaginal dryness, and other, issues in the vaginal microbiome. Is there anything in that phase of life it's crucial to do to potentially mitigate the loss of the lactobacilli and just encourage stability of the vaginal microbiome in that perimenopause phase?
The single most effective thing that we have at the moment is HRT, hormonal replacement therapy, which has been clinically demonstrated to, as you say, support estrogen, which then supports the vaginal microbiome. I feel quite scared for my generation because we're bombarded with this dichotomy of the contraceptive pill, which is one type of hormonal replacement therapy, is evil. It's going to give you cancer. It's going to influence your brain. It's going to make you not like your partner, etc., etc. And then on the other end of the spectrum, we're told HRT is perfect and amazing, and it never has any side effects, etc. So I feel very passionately about the importance for us to start prescribing both contraception and hormonal replacement therapy in a smarter, more educated way, because at the moment it is a bit Russian roulette like. If you're looking to get hormonal contraception, you're going to be recommended a few different types. You're going to try them out for 6 months, for 7 months. Some of them will give you side effects, others will not. And same for HRT. And we start always women on the same dose, regardless of their body weight, regardless of their metabolism, regardless of any pre-existing health conditions. So one thing that I really hope someone develops, and I know there's a number of companies working on this, is a contraception recommendation engine, which takes a look at your medical history, your personal preferences, your lifestyle, and then makes an educated recommendation on which type of contraception you should start with, so that you have a lower risk of experiencing side effects and a higher likelihood of experiencing side benefits. And same, we need to do the same for hormonal replacement therapy as well, so that patients can minimize side effects, maximize side benefits. And beyond hormonal replacement therapy, if you are in the perimenopause, menopause time of life, eating a diet that is rich in prebiotic and probiotic foods, ensuring that you wear underwear which is made out of natural materials, such as cotton or hemp or bamboo, really helps regulate your temperature in your intimate area, which then reduces the likelihood of pathogenic organisms increasing and breeding. Avoiding douching at all costs and vaginal deodorants, and being really mindful of any products that you use in the vagina. So that includes tampons, lubricants, condoms. There are brands out there that have been tested for their impact on the vaginal microbiome. There's tampons that have been tested for this, lubes that have been tested for this, condoms that have been tested for this. And it's very important that you use one which was specifically developed for the vagina and tested for their impact on the vaginal microbiome.
I think also one of the issues with lack of education is maybe also a lack of understanding across the board, both men and women, about the anatomy, of the vagina and the vulva. A lot of people don't actually appreciate the difference between the vulva and the vagina. And it's probably worth someone knowing their intimate anatomy pretty well, like what glands are down there. I would hazard a guess and say that most people haven't heard of Bartholin's glands, and they can easily get blocked. They're not an uncommon cause of surgical emergencies for the gynecologist, blocked Bartholin's glands leading to abscesses. So I think it's worth at least knowing that, so then you know how to take care of it or what not to do. And something that you obviously do at Daye is you encourage some of this empowering and making people take more ownership of their health. And something which is a very commodity thing, like a tampon, people are using it very frequently during the course of a month. It seems, before I came across what you were doing, that it's a very untapped resource of information and, a potential to mine for very useful data, because you can actually collect samples and get data from that. But, typically people were using tampons without getting any diagnostic value. But actually what you do at Daye, you have these tampons which can be double both as a therapeutic tool, but also as a diagnostic tool as well. Can you tell me a little bit more about why you decided to go down that route and what metrics someone can get from that?
So I struggled with a number of different gynecological health horror stories when I was growing up. I had incredibly painful periods, and then I had these ovarian cysts, which turned out to be filled with hair and teeth, because sometimes apparently ovarian cysts can do that. And there wasn't, at the time when I was a teenager and got diagnosed with these ovarian cysts, there wasn't one school of thought. There was a clinical divergence on what you should do with ovarian cysts. So I got a admitted into hospital for surgery one night from, the first shift of doctors. And then in the morning, the second shift of doctors discharged me because they said, oh, no, we do not operate on these types of ovarian cysts. And initially, I thought that my experiences were very unusual and unique, and that I just had a lot of really bad luck. But then through conversations with my friends and my peers, I realized that everyone has a gynecological health horror story. And I grew to have a really strong appreciation for the gender health gap, for the lack of innovation within women's health, the lack of funding within women's health, which is really what pushed me to want to develop a new set of medical and diagnostic devices that could serve women better. And thinking along these lines and using tampons, I thought to myself, okay, these could potentially be such powerful tools for therapeutics, for diagnostics, for just learning more about your body. And we're already familiar with tampons. Like, no one needs to train a woman on how to use a tampon because we've used them already multiple times in our lives. Then I came across the first pass uterine effect. So realizing that when you deliver medications vaginally, it's actually one of the most effective ways to deliver medications for women specifically, because you entirely disengage the digestive tract, you entirely disengage the liver, as vaginally administered medications are recycled through your pelvic floor and your ovarian arteries. So I had the idea to develop a therapeutic tampon. And alongside that, I had the idea to develop a diagnostic tampon, which would collect the sample from the vaginal environment, from the cervical environment, and then you can ship that off to a lab in order to understand whether you have an STI, a vaginal infection, whether you have HPV, which, other than the fact that it causes cervical cancer, if it's a high-risk HPV strain, is also a disruptor to your fertility. In many patients, it is asymptomatic, but it can disrupt your fertility outcomes. And this idea led me to discover a lot about the tampon industry. So despite the fact that we use tampons on a regular basis, and they're a very popular tool, and you can find them in every supermarket shelf, they're entirely unregulated. They're not seen as medical devices, which means that they don't have to be produced in clean rooms, they don't have to be batch tested, they don't have to be sanitized, there doesn't have to be metal detection. So there are a lot of structural issues with the way in which we manufacture tampons, which I was just very surprised by. And just for context, hand sanitizer is a medical device. Those little wooden sticks that doctors use to put your tongue down when they're giving you an oral exam, that's a medical device.
Wow.
But the tampon, for some reason, is not a medical device. And then that's what led me to, build our own production facility with our own machines, where we could determine the quality standards by ourselves. And as a result of this, as a result of being, the only tampon that produces to medical device standards, we could then explore these other therapeutic and diagnostic possibilities with the tampon as a familiar and convenient tool.
Only 5% of us are feeding our guts properly. That means 95% of us are accidentally starving our microbiomes, and we feel it through bloating, sluggish digestion, and other symptoms and health challenges. That's why I created Loam, a 6-in-1 prebiotic fiber blend designed to cultivate a nourished, thriving gut. Each serving delivers 10 grams of plant-based fibers, making it that much easier to feed the gut bacteria that fuel your digestion, immune system, metabolism, mood, and more. And the best part is it's completely invisible. No taste, no texture, no grit. Loam dissolves into anything and literally disappears into your day. If you want your whole health to thrive, start by feeding the ecosystem that runs the show. Head to www.loamscience.com to try Loam. And exclusively for you, just because you're listening to this podcast, get an additional 10% off with the code POD10. Again, that's POD10 to try Loam and get an additional 10% off. Loam, health grows here. Now, you mentioned there about sort of just testing and the rigors of being a medical device versus not, and then how the tampons weren't. A couple of years back, there was this huge uproar and wave of concern on social media about, the presence of heavy metals in tampons, right? So tampons are obviously created from natural ingredients in many cases, which come from the earth. And natural ingredients have some baseline level of heavy metals. So, whether it's the supplements you take, if they're fiber based, or even the foods you eat. I think one tomato has like a few micrograms of lead, for example, which is part of the Earth's crust, and then it's grown with the food. So similarly, tampons will have some baseline level of heavy metal contamination. However, given that it's something which someone could be exposed to cumulatively, there's this cumulative exposure, there could be the risk that if someone doesn't test for heavy metals and there is a higher than the acceptable threshold amounts of heavy metals, there's a higher risk of an overly concerning amount of cumulative exposure to heavy metals in certain brands that maybe don't prioritize their testing. What is the process of testing, and why is that such a big issue for you?
I mean, I really don't understand why we don't do more testing and why we don't have better safety controls, because it's not that hard to introduce continuous batch testing in your production. It's not that hard to introduce sanitization. And heavy metals are one of the issues with tampons, that you can engineer and test your way out of having heavy metals in your tampons. But there's also PFAs, forever chemicals. So about 95% of the tampon products that we use in the UK are made out of petrol-derived plastic fibers. The industry moved away from using cotton and other natural materials in the 80s as plastics run faster on production lines, so you can make more tampons per minute. But even if you're using organic materials, it doesn't have to be cotton, which we know is a very thirsty plant, which requires a lot of pesticides and herbicides and irrigation to grow. You can use other materials like industrial hemp, which grows like a wheat and doesn't require pesticides and herbicides and requires very little irrigation. So you can engineer and test your way out of these issues, just as we do with food supplements. As you say, a lot of food supplement brands test their products for heavy metals and other contaminants. It's just that there's a regulatory gap. It's not required of companies to do these tests for microbiological contamination, for PFAs, for heavy metals, for pesticides. So most companies don't. But in the process of setting up our production facility, of purchasing a clean room, purchasing a metal detector line, setting up a contract with a gamma irradiation supplier so the final tampon could be sterilized, I realized that it's not that deep. It is not so hard. It is not expensive. It's not prohibitively expensive. Yes, it does add a cost, but it's not prohibitively expensive. And it doesn't add too much operational complexity. So I think it's a two-sided issue of, so currently in tampons, no brand owns their manufacturing. So whether you're Procter & Gamble, Kimberly-Clark, or one of the new brands, no one owns their manufacturing. Everyone white labels. So you have very little visibility as a brand over what's actually happening. And I think a lot of people would be quick to assume that because I can find tampons on my supermarket shelf, someone has done their due diligence somewhere along the chain. So there's a lack of ownership of the manufacturing process, and then there's a lack of regulations. So tampons are in this weird gap.
So why doesn't anyone own their own manufacturing facility in the tampon industry? Because, I mean, obviously there is some degree of expense to be vertically integrated and to own that. It's a big cost, but surely, it makes sense that if someone could raise enough money to scale, that eventually they'd want to have their own facility where each step in that supply chain, from sourcing the ingredients to then actually manufacturing it, it would be beneficial to not only have that visibility at every step in that production process, but even from like an innovation standpoint as well, probably could lead to innovations. Because it wasn't too long ago that I read that for decades, tampons were produced with only one style of manufacturing. There's been new innovations now, just in terms of how the fibers are located and how the absorption is done. And for many years, tampons were only tested using non-human blood material as well, which doesn't make sense. So,
saline solution.
So for all those reasons, it would make sense to eventually own your own manufacturing, no?
Well, it's a low margin product.
Mm.
tampons are, and it's a very low innovation industry. And in addition to this, where the countries from which you would typically see manufacturing competition, like China and India, which is where we do a lot of the world's manufacturing, women in China and India don't really use tampons. It's less than 1% of the population. So you don't have local manufacturing competition from the countries that would typically bring manufacturing competition. So we don't have the same issue with the manufacturing of diapers or pads, because diapers and pads are used in China and India. But in Europe, the UK, the US, we have one monopoly organization which owns the tampon manufacturing machines and the IP for that. And because it's a low margin, low innovation, high operational complexity to build your own machine, a lot of the brands don't do it. And then separately from this, in the femtech sector, the innovation sector, it is so painfully hard to fundraise, and tampons are so stigmatized. Um, you have no idea the difficulties that I have, walking into a meeting room in, those fancy London offices or the fancy New York offices, and I have to talk to a, usually room full of elderly men who do not want to hear about tampons today. They simply don't. So we see that in the percentages, right? Like femtech as a whole gets about 1% of the total share of capital for healthcare. Female founders get about 2% of the total share of venture capital. So that is also another industry barrier.
Yeah, I was pretty shocked to hear that. I won't name them here, but there's a huge period tracking company that I found out that actually the founder was a man. Not that itself is inherently wrong, but I was just surprised because obviously they're one of the first unicorns. So billion-dollar companies in the period or in the kind of femtech space, and I assumed for a very long time that it was actually a woman who founded that company. But in this space, in the femtech space, and specifically what we're talking about, the vaginal microbiome, we've heard of fecal microbiota transplants for the gut and how that is emerging science that has some good evidence for specific conditions. I wonder if there's any growing interest in vaginal transplants for the vaginal microbiome.
Yep. So again, out of Brigham's Women's Hospital and the Mayo Clinic, there's some very exciting research coming out of vaginal microbiome transplants being a highly effective treatment opportunity for bacterial vaginosis, yeast infections, and recurrent UTIs. Because even though at the moment we have treatments which are effective at removing Gardnerella, which causes bacterial vaginosis, or removing Candida, which causes a yeast infection, we do not have precise treatments. The antibiotics, the antifungals that we have, they wipe all microbiota indiscriminately. So as you said earlier, sometimes it can take months, sometimes it can take years for a patient who has been particularly through multiple cycles of antibiotics and antifungals to regain the health of their vaginal microbiota. So what we're seeing out of these research labs is a treatment pathway which doesn't kill the lactobacilli. It actually contributes to having more lactobacilli counts, but the lactobacilli themselves grow to a ratio in the vaginal microbiota where the lactobacilli, instead of an antibiotic or an antifungal, are able to treat the presence of bacterial vaginosis or candida. So this is something that I feel very excited about. We need to develop personalized lactobacilli strains which can be used to end this cycle of recurrent UTIs, recurrent BV, recurrent thrush.
Yeah, I think the probiotic space is very interesting because even though the market is flooded with probiotics, it's unfortunately not flooded with precision next generation probiotics, which could work for specific instances. I think something, we've not covered this, but obviously we've spoken about tampons and concerns from many people, users, that, they could be toxic. And because of that myth or misunderstanding about tampons, there's been a shift towards period underwear. Period underwear, obviously, there's also the risk that it could create a moist, damp environment, which could then encourage the wrong type of bacteria to thrive. So period underwear as an alternative to tampons, is that a better solution or is it more problematic long term?
For some people, it could be better. It's very important to just look for your own individual symptoms. And the one thing to be mindful of when it comes to period underwear, that in order for them to create this highly absorbent core, which, can store, I think some of the brands advertise up to 2 tampons worth of menstrual blood in the period underwear, that requires PFAs. So that requires these forever chemicals, which we know are endocrine disruptors, which haven't, as you say, they haven't yet been fully studied. So we don't know what long-term chronic exposure to PFAs does to the reproductive tract. So at the moment, and I'm sorry I don't have a more satisfying answer, the best thing that a individual can do is track their own vaginal microbiome health and see how different lifestyle changes, how different interventions that they're trying out or introducing are having an impact on their vaginal health. Because as you say, beyond the PFA issue with period pants, the other key problem is the moisture, the high moisture environment that they create. And then separately, menstrual blood has a very different pH to the vaginal microbiota. So then you're exposed for a longer period of time to that pH. But no one has done the research, so we don't know.
Yeah, as someone who's personally been looking and reading microbiome research for over 10 years, it's dawned on me that we know very little about the gut microbiome, even though we've made huge strides. I feel we're really at the tip of the iceberg. And as I'm beginning to learn more about other microbiomes in other organ systems, particularly the vaginal microbiome, it's apparent that, that's even less clarity on what's going on there. And I'm glad, you're championing the advancement of research and technology, and championing the future of femtech from that side of things. And hopefully, this conversation is pretty enlightening to people who've never even heard of the vaginal microbiome before. So Valentina, thank you so much.
Oh, thank you so much for having me.
I really hope you enjoyed this episode. Please subscribe to the channel if you've taken anything away from today's conversation. If you want to learn more about loam science and the novel 6-in-1 prebiotic fiber, you can go to loamscience.com. And remember, if you'd like to find out even more about Throne and their incredible new smart toilet device, go to thronescience.com.